Welcome to Healing Horizons, where soul meets real world transformation. I'm your host, Saima. For over 2 decades, Dr. Kevin Smith has been helping people who have tried everything finally find answers. As a functional medicine practitioner, he looks past the symptoms to uncover the real causes behind chronic pain, thyroid disorders, autoimmune issues, gut problems, and more. His mission is to empower patients with understanding, give them back their independence, and restore health from the inside out. Tonight, we explore what happens when medicine stops chasing symptoms and starts solving problems at their roots. So, Dr. Kevin Smith, welcome to the show.
Thank you for having me. I appreciate it.
You're welcome. It's my pleasure to have you here. So, Dr. Kevin, what first led you to shift from traditional approaches to functional medicine?
I started I started my journey with functional medicine approximately 25 years ago. And I found that there was a problem with the way that healthcare was being done. In the broadest sense, there's two different types of healthcare in America. There is allopathic healthcare and there is functional medicine. Allopathic healthcare is what a medical doctor would do. And so their mission is to try to quell symptoms with drugs. And that's the predominant form of healthcare in my country. Functional
Mm-hmm.
medicine, on the other hand, it takes a different approach, different philosophy. Rather than chasing symptoms with drugs, functional medicine looks to discover and uncover the hidden root causes of what's actually driving the problem in the first place. So, for example, if you have, if a person has digestion problems, whether it's constipation or diarrhea or inflammatory bowel disease, the medical doctor never asks the question, why? Why? What's causing this? What's driving the problem? They just reach for a certain drug to say, here, try this and see if this helps you. The
Mm-hmm.
functional medicine doctor, on the other hand, is going to look at what could be contributing to cause the problem, whether it's something that the person is eating or a medication that they're taking that can cause a side effect, or some kind of an autoimmune disease that could be the root cause of the problem. And so it requires a little bit of work, a little bit of detective work to figure out what's the root cause of the problem. And medical doctors don't do that in this country.
That's such a fascinating turning point you have described, Kevin. And I really appreciate the way you have unpacked not just the decision itself, but the deeper motivations behind it. It's clear that your journey wasn't just about changing techniques, but about fundamentally rethinking how you approach the root causes of health challenges. And that's really powerful.
I agree.
Hmm. So, was there a patient case that made the decision crystal clear for you?
There's been a lot of them. I see a lot of people that have what I refer to as metabolic disorders. Metabolic disorders are things that, like thyroid problems or autoimmunity issues or gut problems or brain problems that can affect your cognition, your mood, your ability to manage stress, things like that. I was just really frustrated with when my patients would say, um, I have this problem and I'm taking these drugs, and I have
Mm-hmm.
this problem and I'm taking these drugs. And when people first come to see me, they bring their drug list because I want to see what they're taking. And the most that I've ever seen in my career was a guy that walked in my office. His drug list was a page and a half single space typed from all the drugs that he was taking. And he walked in kind of like a zombie because he was so out of it from all the side effects from all the medications. Every drug out there has a side effect. And sometimes these side effects can be very, very bad. They can be very, very damaging to the individual. I've had family members that have had massive health problems because of side effects from the drugs that were prescribed to them by their doctors. And, along the way, I started to wonder, is there a better way to fix this problem other than just throw drugs at the problem? And that led me down the rabbit hole to like explore um, lab testing and um, blood chemistry analysis and all the other types of lab tests that we do, find out the root cause of what's driving the person's problem.
Mm-hmm. Yes, I agree. It's often that one eye-opening moment that changes the course of a career. Now, uh, when someone's been struggling for years without answers, where do you start?
That's a great question. Where do you start when you have a problem that's been going on for a long time and nobody's been able to help them? The first place I start is by gathering some information. So I start the person by having them fill out some paperwork to explore their medical history. I want to see what they've been through, what they're experiencing, how long they've had it, who they've gone to see, what has been the outcome of that, all those types of questions. After that, then we do a case review, which is a consultation where I would meet with them either personally on the phone or through Zoom, and I would ask them some questions like, what are your goals? What would make you happy? What are you up against? What is really bothering you? And gather some information from that. From there, I would have them fill out some questionnaires. The questionnaires are not a diagnostic. They're just a place for us to start looking. There's a metabolic questionnaire, there's a neurological questionnaire, and those do it. They explore kind of deep about what's been going on with the person's physiology, how different systems of their body are affected by this, whether it's their gut or their ability to utilize blood sugar or their pancreas or sex hormones, or maybe it's their brain. So after that, then the next step is to proceed to some lab testing. So my method is to order a foundational lab test just to cover the basics and get a good medical foundation. So we start off with blood tests and urine tests. And from there, we can objectively measure how the person is doing, where they're having some stress points. And from there, that also gives me an understanding about how severe that their problem is and what would be the best next step.
Mm-hmm. That's such a thoughtful approach, I must say, Kevin, and it really shows how much you value starting with the person's full story before jumping into solutions. And I like how you are not just looking at isolated symptoms, but painting a complete picture, as you said, from what they have endured over the years to how those experiences connect to what they truly, want for their health moving forward. It's like almost like your peers are piecing together a puzzle where every, document, every detail, and every personal goal adds depth to your understanding. And that kind of deep listening
That's
and
a very, very good observation. I liken
Mhm.
myself to like a medical detective where you have to dig deep and find out what's the hidden root cause that's driving their problem, as opposed to just superficially chasing down their symptoms with drugs. And, more and more people are more fascinated by figuring out why do I have this problem? What caused this issue? It's not enough just to chase a symptom. So, for example, if you have a fever and you feel sick, why do you have a fever? What's going on in your body? Maybe it was something that you ate. Maybe the night before you had fish and the fish was not good. It had a very bad reaction in your body. And that caused you to have a fever, caused you to feel sick. And the body's way of dealing with that problem is by expelling the bad fish, by having diarrhea or vomiting or just getting it out of the body. In America, the way that a lot of people will deal with that problem is by taking a drug like Imodium to stop the diarrhea or taking a drug to stop the vomiting. Now, my question is it better to get rid of that poison out of the body, or is it better to trap it in the body? And that's where a lot of people are like, "Oh my God, you're right. I never thought of that before."
That really makes a lot of sense, Kevin. So, how do you rebuild hope in patients who feel defeated?
I give them hope by doing things that other people haven't done. I found that the way that most people approach things is if they go, like, let's say, for example, they go to see their primary care doctor. That doctor is going to start off by ordering a very, very small amount of lab testing. And he's going to do that in order to justify, arrive at a diagnosis in order to justify prescribing a drug. In other words, the medical doctor is going to do exactly whatever the insurance company is going to dictate to them. So by the time that a person even walks into the primary care physician's office, their treatment plan has already been predetermined by the insurance company, by an actuary that works for the insurance company that is in a different city, has never met the person, has never interviewed them, doesn't know what their lab tests are, doesn't understand their history, none of that stuff. And so what the end result is that it's a bad diagnosis. It's chasing symptoms with drugs, and the person ends up feeling defeated. And the way around that is by looking at what can I do to really fix this problem by looking at all the different aspects that could be contributing to their symptoms, not just chasing the symptoms with a simple drug, but by looking at the person as a whole. And that's how I help people, give them hope, and get them on the road to recovery.
Mm-hmm. Yes. I too agree that rebuilding hope isn't just about offering reassurance, it's about helping someone see a path forward that feels real. And that's such a compassionate way to look at it. And I can hear how much attention you bring to that process.
I do. I bring a lot. It's a labor intensive process to dig down and figure out what's the root cause of the problem. But sometimes these problems are complicated. Sometimes they have a lot of different factors that go into why the person feels the way that they do right now. And so my job is to be that hidden detective to figure out what is going on in front of me and piece it together.
Mm-hmm. Mm-hmm. That's remarkable. Now, you have worked with thousands of patients, so I'm really eager to know that what's the most surprising root cause you have ever uncovered?
I don't know. I would say that dietary things, what people eat, has plays a huge role in the outcomes. But it's surprising for the patient how big of an impact that their diet and lifestyle will play into their overall picture. As an example, um, well, I had a patient one time, a 20-year-old woman, and she came in with her mom. She was having fibromyalgia and headaches. She couldn't sleep. She was in terrible pain all the time. And they went to see everybody. They went to see when she was a kid, she went to see her pediatrician. She went to a gastroenterologist, which is a stomach doctor. She went to a pain clinic. She went to uh, all these fancy medical clinics in Pittsburgh, and nobody could figure out what the root cause of the problem, why she was suffering so bad. I did a food allergy test. It's a simple test. The person draws some blood at home and puts it on a test card, and then we compare that to 95 different food allergens. And it turns out that she had a severe reaction to eggs and chicken and garlic and green beans. And that is exactly the stuff that her mom was feeding her because she was trying to clean up her diet, and she had no idea that the foods that she was eating was actually causing the problem. So I told her stop with those foods immediately, and just like that, the problems went away. And they were just absolutely blown away by what I had discovered that eluded every other medical doctor that she went to.
Mm-hmm. The way you describe that, Kevin, like uncovering that particular cause, makes it clear how much persistent and investigative thinking it takes, and it must be incredibly rewarding, to see how one breakthrough like that, can ripple out into dramatic improvements for a patient's life. And I really love how your story shows, like the example you gave, it shows not always the obvious textbook explanations we expect, but often something unexpected, yet once identified, it completely changes the course of someone's health journey.
I agree.
Yes. Now, like, did solving it completely change the person's life?
It did. It gave her happiness. She could sleep. She was sleeping like a baby, had no more
Mhm.
problems. And to this day, I still see them, and they're very, very grateful that somebody took the time to run this test to find out what was going on with her body. She had no idea.
Mhm.
And the medical doctors that she went to, they put her on all kinds of drugs, and some of which she had an allergic reaction to those drugs. And so by the way, I'm not anti-drug. I'm not anti-physician. I believe that there's a time and a place for all healing. There's a time and a
Mhm.
place for antibiotic therapy. There's a time and a place for steroids. There's a time and a place for surgery. Um, I just I'm interested in looking in places that other people may have missed, may have not really done a thorough job at exploring what is the contributory issues that are impacting this case.
That makes sense, yes. And it's incredible how one hidden factor can turn someone's health story around.
I agree. Yeah.
Yes. Now, if a listener suspects their chronic condition has a deeper cause, what's the first step they should take?
The first thing that somebody should take is to look at their lifestyle. How are they eating good quality food? Are they exercising? Are they getting enough sleep? Are they managing their stress? There's a lot of things. There's a couple things that everybody should be doing to optimize their level of wellness and function. Once you have explored that, and if there's still something going on, the next step would be to contact a functional medicine practitioner and see what they can do to try to help you, as opposed to just running to the medicine cabinet, taking a over-the-counter pill, or running to the primary care physician and seeing if they can give them something stronger. Um, we in America, we live in a drug culture, and in America, we have drug ads on TV 24 hours a day that are just continuously brainwashing people into buying medicine. whatever the problem is, there's a drug solution for it. And like I said, sometimes there's a time and a place for that. But I think that the place to start is by looking at a person's lifestyle. That's the first part.
Mm-hmm. I like how you have made that first step feel so doable, Kevin. It really takes intimidation out of getting started.
Yeah, I think that a lot of people are intimidated because, especially when they have a chronic problem or a problem that's been bugging them for a long time, oftentimes don't even know where to start. And so the place to start is by looking at your own lifestyle, looking at your diet, looking at your sleeping, looking at your exercising, and you're managing your stress and things like that. Once you have done sufficient work in that realm, then the next step is to go in the functional medicine route and figure out maybe there's something that's going on. A lot of people, for example, they think that their problems are because of bad genes or bad genetics. I have found that it's mostly 95% lifestyle based or 95% environmental and only 5% of it is genetic. Now there are plenty of examples of things that are genetic related, but like for example, if a person has thyroid problems, um, are they looking at do they have blood sugar problems? Do they have inflammation? Do they have a chemical sensitivity, or maybe an anemia that is causing the thyroid to get um, uh, having problems? It's very rarely the thyroid's fault. It's usually something else, whether it's autoimmune disease or it is a food allergy or a GI problem that is the root cause of it.
Mm-hmm. That's remarkable, and I'm sure that's going to be beneficial for all our listeners out there. So, Dr. Smith's work already reminds us that true healing begins when we stop treating bodies like a collection of symptoms and start honoring them as complex, interconnected systems. So, listeners, if you have been chasing answers, maybe it's time to pause, dig deeper, and uncover the root cause because relief is good, but restoration is life changing.
Well, thank you for allowing me the time to be on your show and speak to people. I I I love to inform people and to show them that there's another way to fixing a problem. Just like there's more than one way to cook an egg, there's more than one way to fix a health problem. Drugs are one solution, but that's not the only solution that's available to you. And so you want to just keep in the back of your mind the thought that there is all kinds of approaches available. There's physical therapy, there's massage therapy, there's acupuncture, chiropractic, there's going to the gym and working out with a personal trainer. There's all these things that are available and that's just for fixing say something like back pain. If you have a problem like thyroid problems or gut problems, there's multiple ways of treating that effectively, more so than just masking your symptoms with drugs.
Mm-hmm. That was again a great reminder, Dr. Kevin.